Have you ever stopped to think about what your last 24 hours of life would be like? Death is the only certain destiny that we all have, but few know how to recognize the signs that it is approaching. In this video, we will delve into the 7 clearest signs that the end may be closer than you think. It is not about fear, but about being prepared. What if you could recognize these signs in someone you love, or even in yourself? Stay with me, and we will discover what most people prefer not to see. Death is a certainty that we will all face, but for many, it is a subject surrounded by mystery and even fear. However, understanding the signs that the body is preparing for the end can be valuable knowledge, both for those going through this moment and for their loved ones. This video is not about predicting the future, but about recognizing the signs that the body gives in its final days. Knowing what to expect can help alleviate fear, give time for important decisions, and most importantly, provide more comfort and dignity at the end of life. Let's explore these 7 signs together and understand how they are part of the natural process of saying goodbye. The first sign that death is approaching is increased sleep. When a person is in the final stages of life, their body begins to slow down dramatically. Metabolism slows down, and with it, energy levels drop significantly. This causes the person to sleep much more than normal. They feel constantly tired, with no desire to get up, and simple activities, such as eating or talking, become an enormous effort. This increased sleep is a way for the body to prepare for the end, saving energy for essential functions. For caregivers, this sign can be distressing, but it is important to remember that sleeping more is a natural response of the body. Providing comfort and a calm environment can make all the difference at this stage. The second sign that death is approaching is muscle weakness and loss of mobility. As the body approaches its end, it begins to lose the ability to perform even the simplest tasks. Muscles that were once capable of supporting everyday movements become weak and unable to function properly. The person may have difficulty getting out of bed, walking, or even holding objects. Movements such as eating or even speaking may become challenging. This extreme weakness is a clear sign that the body is conserving energy for vital functions. In the final days, many people end up confined to bed, without the strength to move on their own. For caregivers, this can be a difficult time, but it is important to remember that this is a natural part of the dying process. The best way to help at this time is to ensure that the person is comfortable, offering physical and emotional support, and adapting the environment to facilitate rest and dignity for the patient. The third sign that indicates the approach of death is changes in appetite. As the body begins to slow down its vital functions, the need for energy decreases, and with it, the desire to eat also disappears. Foods that were previously enjoyed lose their flavor, and the person may refuse both food and liquids. This is not a conscious choice, but a natural response of the body, which no longer needs as many nutrients to continue functioning. For family members and caregivers, this lack of appetite can be alarming, but it is important to understand that forcing food is not the solution. The focus should be on providing comfort and allowing the person to eat what they want, when they want, in small quantities. It is also essential to ensure adequate hydration, but respect the body's natural limits at this stage. Accepting these changes is part of the process, and helps ensure a smoother and more comfortable transition. The fourth sign that death is approaching is irregular breathing. As the body begins to shut down, the breathing pattern can change dramatically. Breathing may become slower, shallower, or in some cases, there may be longer pauses between breaths. A common example is Cheyne-Stokes respiration, which is characterized by cycles of rapid breaths followed by periods of apnea, where it appears as if the person has stopped breathing for a few moments. These changes in breathing can be difficult for caregivers to notice, who may feel fear or concern when they see these pauses. However, it is important to understand that this is part of the body's natural process of shutting down. The brain and heart are sending signals to reduce the work of breathing. To help keep the environment calm, make sure the person is in a comfortable position, and, if necessary, talk to a healthcare provider about using palliative measures to provide more comfort. Irregular breathing is one of the most visible signs, but it is also a reminder that the body is preparing to rest. The fifth sign that death is approaching is confusion and disorientation. As the body begins to fail, the brain also begins to function erratically. This can lead to moments of mental confusion, where the person has difficulty recognizing loved ones, does not know where they are, or loses track of time. These episodes of disorientation may be accompanied by agitation, restlessness, or even hallucinations, where the person talks to people who are not there or sees things that are not there. These moments can be extremely difficult for family members, who may feel helpless to see someone they love acting so differently. However, this confusion is a normal part of the dying process. The best way to deal with it is to remain calm. Speak to the person in a gentle and comforting way, reminding them that they are safe and surrounded by people who love them. Refraining from confronting the person about their disorientation and offering emotional support can help ease anxiety and discomfort at this difficult time. The sixth sign that indicates the approach of death is social distancing. Many people in the final stages of life begin to emotionally distance themselves from those around them. They may start to talk less, avoid conversations or interactions, and prefer moments of silence and solitude. This distancing is not necessarily a sign of sadness or depression, but rather a natural response of the body and mind that, consciously or not, begins to accept the end of the journey. For family and friends, this distancing can be painful, as it may seem as if the person is disconnecting emotionally. However, it is important to understand that this behavior is part of the farewell process. Respecting this desire for introspection is essential. Offer your presence in a silent and respectful way, allowing the person to have their space, but always being close by for when they need comfort or company. This time of silence is often a moment of reflection for the person who is passing away, and allowing this peace is a way of offering dignity and understanding in the final moments. The seventh and final sign that death is approaching is visible physical changes. As the body approaches its end, several changes in appearance may be noticed. The skin may become paler or take on a bluish tint, especially on the extremities, such as the hands and feet, due to reduced blood circulation. Body temperature may drop, and the person may feel cold, even in warm environments. In addition, the eyes may appear more glassy or dull, and the lips may dry out. These changes may be difficult for those caring for the person to see, but it is important to understand that they are part of the body's natural process of shutting down. At this stage, the focus should be on providing comfort by keeping the person warm and hydrated. Using blankets and moistening the lips can help ease discomfort. Accepting these physical changes as signs of the end of life can help both the caregiver and the person who is passing find peace in this inevitable time. As we say goodbye to those we love, it is essential to remember that death is part of the natural cycle of life. Although the process can be difficult, understanding the signs our bodies give us as death approaches can bring some clarity and even relief at such a delicate time. Every journey is unique, just as every person is unique, and accepting this can provide a sense of peace. This video sought to shed light on the 7 most common signs that indicate the end of life is near, not to create fear, but to offer understanding and comfort. By recognizing these signs, you can be better prepared to deal with them, helping both yourself and the person going through this time. The important thing is to ensure that your farewell is dignified, respectful, and full of love. Death is an inevitable process, but care and respect can make this moment more human. Thank you for watching, and remember that even in the most difficult moments, we are never alone.